living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
1 in every 2 men, or half of all men, will have an enlarged prostate by the time they turn 60, and that percentage only goes up with age. What does that mean, and why should men care about their prostate health? Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown. Today, we're going to talk about the prostate and health-related issues, including prostate cancer, which is a leading cause of cancer deaths among men. Stay with us. Welcome back to Healthy Living for Life. Joining us this morning is Dr. Kevin Brown, who's a urologist who is going to talk to us about the prostate and prostate health. And thanks so much for joining us this morning, Dr. Brown.
My pleasure.
So let's first start out by defining what we're talking about. What is the prostate?
Yeah, so the prostate is a typically walnut-sized gland that sits at the base of the bladder, and the urethra goes through the prostate, and the urine, when it gets squeezed out of the bladder, travels through the center of the prostate through the urethra.
So you talked about where the prostate is. What is the prostate's job?
So primarily the prostate is there to secrete fluid to help support healthy sperm as they travel through the ejaculatory tract and try to keep them healthy and happy. And outside of that, it doesn't play a big role in health otherwise. That's its main purpose.
Okay. And so we know that the prostate, like many parts of our bodies, change with age, but what specifically happens to the prostate as a man gets older?
Yeah, so the prostate is like similar organs in the body where it's very sensitive to hormones, and as it's exposed to testosterone over the course of a man's life, it continues to increase in size and can grow and eventually get to an enlarged size where it starts to cause problems and symptoms. But the general trend is that we see the prostate slowly enlarge, and most men by age 60, about 50% of men will have some symptoms from an enlarged prostate, and that number continues to increase all the way up to about 90% of men who are in their 80s.
Okay, and we'll talk a little bit about some of those symptoms here shortly, but as far as getting checked and having a doctor look at the prostate, at what age should men start getting exams?
Yes, that's a great question, and it kind of has shifted a lot over the course of time, and different governing bodies have weighed in. And so as urologists, we typically follow the recommendations from the American Urologic Association, and they recommend that patients between ages 55 and 70 should undergo a routine prostate evaluation.
And so what exactly does that entail? Can you tell us a little bit about what happens during the exam and what is a doctor looking for?
Yeah, so when I evaluate patients and are trying to establish, prostate health, we take a couple of different measurements as far as checking a urine sample. We do some basic blood work, and one of the tests we use is called PSA, or prostate-specific antigen, which is a screening test for prostate cancer. And then we'll also occasionally do ultrasound imaging to see how well the bladder is able to empty out around the prostate. We combine that with physical exams, and that gives us an idea of the shape and the size of the prostate as well.
And so what does an exam entail? What can somebody expect if they're going in to get that exam?
Yeah, so the main way that we do a physical exam for the prostate is called a digital rectal exam, where we insert a finger into the rectum, and because of the proximity of the prostate to the rectum, we're able to feel the prostate through the rectal wall, and that allows us to feel the size and shape of the prostate. And we also use that to evaluate for any abnormal nodules that could be concerning for prostate cancer.
And you mentioned the ages that between men should start getting the exams, but how often should a gentleman go in and get one of these?
Yeah, so the recommendations are every 1 to 2 years, and that's based off of overall health, life expectancy, and risk factors for prostate cancer.
Okay, and so that was going to actually be my next question is, does it depend on a person's health, or should they really be trying to get one every 1 or 2 years?
Yeah, so generally when we talk about prostate cancer, we look at your overall health, and the general recommendation is that if you have a life expectancy of at least 10 to 15 years, then you should be having routine prostate cancer screening.
Okay. We talk a lot on this show about the role that family history can play when it comes to health. Is that similar with prostate health? Should people know what their family history is?
Yeah, family history plays a really big role in your risk for prostate cancer. So studies looking at family history and prostate cancer have shown that if you have a brother with prostate cancer, you have about 2 times the risk of the normal population of getting prostate cancer yourself. And if you have a father and a brother with prostate cancer, that can increase your risk almost 3 times.
Wow, okay. And so is that the main piece of family history that men should be cognizant of, or are there other prostate health issues that they should know about in their family?
Yeah, so prostate cancer is certainly one part. There can be a trend in family members. If one individual has an enlarged prostate, that can affect other family members as well. So knowing that aspect of overall prostate health and urinary symptoms can help predict sometimes the effects that it may have later in life on other members of the family.
Okay. So you talked about what someone can expect when he goes in to get an exam. I know there are a lot of men out there who would prefer not to get those exams done. What's some advice that you have for those gentlemen who are hesitant about going in and getting one of these exams?
Yeah, I think, there is a lot of apprehension in that exam. It's uncomfortable for the patient, and it provides us a lot of really good information, and it's one of the key pieces that as urologists we use to screen for prostate cancer. And so, when I do these exams, I try to talk the individual through it, let you know everything that I'm doing, what you can expect, and try to make it as comfortable as possible.
Okay, perfect. So it's more important to go in and know how your health is doing, even if it's uncomfortable for a minute.
Yeah, knowledge is power. And so the more information we can get, the better decisions we can make in trying to preserve health in the long run.
Okay, perfect. Thank you, Dr. Brown. That's great information. We do need to pause here quickly for just a quick break. But when we come back, we're going to talk about some of the common health issues related to the prostate, like prostate cancer, and even maybe how we can prevent them. So stay with us. We'll be back right after these messages. Welcome back to Healthy Living for Life. We're talking this morning with Dr. Kevin Brown, who's here to talk to us about the prostate and health-related issues to the prostate. And thank you again for being with us, Dr. Brown. So let's talk about some of those common issues. And a big one is prostatitis. And there are 2 types of prostatitis, as I understand it, chronic and bacterial. So can you speak a little bit to each one and what causes these 2 types?
Yeah, so they both have very similar symptoms. It's mostly a lot of burning, pressure, discomfort with urination, some pressure down in the pelvis. Sometimes in the acute infection, you can have fevers and chills. And the biggest differentiation is bacterial prostatitis is due to a bacterial infection and often responds well to antibiotics. Chronic prostatitis is more of an inflammatory response and usually is treated with other medications like anti-inflammatories or preventative medications.
Okay, do we know what causes them?
So we don't have a great grasp on what causes chronic prostatitis. We do know that men who develop acute prostatitis have a higher risk of getting chronic prostatitis. And the thought process is that once you get that inflammation and irritation from the infection, that it causes an ongoing inflammatory cascade within the prostate tissue that can continue.
Okay. Are there men who are more susceptible to prostatitis than others? Who's at risk?
So generally speaking, middle-aged men have a higher rate of developing prostatitis. Anyone who is immunocompromised has a higher risk of developing bacterial prostatitis because you have a harder time of fighting off those infections.
Okay.
And then any issues that make you more prone to getting a bladder infection can lead to a prostate infection or prostatitis. So if you're not emptying your bladder completely, if you're having to strain and have difficulty emptying your bladder, can lead to increased risks of prostatitis as well.
Okay, and how common is it?
So we usually see prostatitis in between 10 and 15% of men. And there are some estimates that number may be underrepresented because people get diagnosed with other issues such as just common urinary tract infections when in fact they do have prostatitis. And so that number may actually be a little bit higher.
Okay. Let's talk now about benign prostatic hyperplasia. Hopefully I'm saying that correctly, or BPH, which is much easier to say. So that tends to affect men who are older, is that right? And what exactly is BPH?
Yeah, so BPH is the benign or non-cancerous growth of prostate tissue.
Okay.
And it's the prostate growth that happens over time in all men. As we discussed before, it becomes more prevalent in age, and about 50% of men by age 60 will have some symptoms from an enlarged prostate.
And you mentioned that the symptoms are similar for the two types of prostatitis. What are the symptoms of BPH?
So the symptoms of BPH revolve around the urination and emptying of your bladder. So the common things that we see is a weak urinary stream, difficulty emptying your bladder, having to start and stop or force your urinary stream to get started. It can also increase the number of times you have to go to the bathroom and how urgent that sensation hits you. And it can also affect how often you have to get up at night if you're not emptying your bladder completely.
And can these prostate issues have complications or have ripple effects when it comes to other health issues?
They certainly can. So over time, the bladder is like a big muscle and it contracts to empty out. And if it's having to work really hard to empty out and fight against the prostate, over time, those muscle fibers can deteriorate and not generate enough strength to empty out. And so it can, over time, if it is a prolonged process, lead to bladder failure and where you can't empty your bladder on your own. It can also increase your risk for urinary tract infections. You can develop bladder stones that would need to be removed. In really severe cases, we see it affect your kidney function and cause kidney damage as well. And
so if someone is seeing some of these symptoms that you mentioned earlier, when is it time to go see a doctor?
Yeah, I think generally, we tell people that if the symptoms are starting to bother you, you should go and get evaluated. I try to talk with patients and kind of evaluate what kind of an impact it's having on their life. And if it feels like it's something that they would benefit from some type of intervention, whether that's a medication or a procedure, then we talk about those things. But I think once you start to notice that it's impacting your quality of life, that's when you should go and get evaluated.
Okay, and you mentioned medication or a procedure. Is that surgery, and when would surgery come into play?
Yeah, so we have a really wide spectrum of treatment options for prostate enlargement and the symptoms that it causes. And, we have medications that have been around for a long time and do have good effects on the symptoms. Some men, over time, the medications don't work as well, or sometimes the side effects of the medications make it so that men don't want to be on them. And so those are the types of situations where we would recommend using surgery as an option over medications.
Okay, and another option I understand is just called watchful waiting. What is that?
Yeah, so watchful waiting is a technique that we employ for men who have some urinary symptoms but aren't bothersome enough that they feel like they would need to take a daily medication or want to undergo a procedure. And so those are the situations where we periodically check how well we're emptying the bladder with the bladder ultrasound, monitor the urinary symptoms and renal function to make sure that there's no impact developing from the enlarged prostate.
Okay, all right, thank you. We need to pause again for another break, but when we come back, we're going to talk about prostate cancer, which is a leading cause of cancer death among men. And then we're also going to talk about overall health preventive steps you can take for overall prostate health. We'll be right back. Stay with us. Welcome back. Urologist Kevin Brown is still speaking with us about prostate and prostate health, and now we're going to focus on prostate cancer. And it is actually a very common form of cancer. I have in front of me that Of all the cancers that affect both men and women, prostate cancer is still in the top 3, even though it only affects men. So do we know what causes prostate cancer?
So we don't exactly know. Like I think is true with many cancers, there's a lot of different factors that go into play, including your overall health, family history. But the general idea is similar to other cancers, where along the way there's some effects that happen to change the DNA of cells within the prostate that make the tissue grow irregularly and spread outside of the prostate and cause systemic problems in the body.
What about risk factors? Are there things that men might be doing that could increase their risk for getting prostate cancer?
Yeah, so we have identified several risk factors over time that increase an individual's risk for prostate cancer, one of which is age. We tend to see prostate cancer more as men age, and that's just an effect of time accumulating and increased risk over time. Your race also plays a role. So African American men and men of Caribbean descent have a higher rate of prostate cancer, and it tends to develop earlier in life as compared to Caucasian men. Family history, as we've talked about a little bit, plays a big role in your risk factor as well. Overall cancer risk as well. So there are some genes that are linked with prostate cancer as well and have a relation to history of breast cancer, ovarian cancer, and colon cancer in the family.
Okay. So we talked earlier about some of the symptoms that other prostate health issues can have. Does prostate cancer, are there signs and symptoms men can look for?
Yeah, so prostate cancer is a tough one because early on there aren't a lot of warning signs or symptoms. And to kind of understand that, prostate cancer tends to develop on the outer side of the prostate. And that's why we do that digital rectal exam, is because we can feel that starting to happen. Because of that, it doesn't cause a lot of early symptoms. But things that we look for that could be a warning sign are worsening urinary symptoms, so difficulty urinating, blood in the urine. If you're having abnormal fatigue, weight loss, bone or joint pain, those are also some worrisome signs.
So you talked about the digital rectal exam. Are there other screenings or tests that are done to confirm that it is cancer?
Yeah, so generally speaking, we use a test called PSA, or prostate-specific antigen, as a general screening test for prostate cancer. And that test is a simple blood test that can be performed fairly easily. And depending on what that number comes back at, the higher the number, the increased risk for prostate cancer. That test has come under some criticism over the last several years as how accurate it may be, because a lot of the times we do further evaluations after an elevated PSA and we don't find prostate cancer. And so trying to help with that, we've come up with some additional blood tests that can identify our individuals that are at higher risk for prostate cancer, in addition to the PSA. Prostate Health Index or 4K score are some of the more common ones that we use. And then over the last 5 or 10 years, multi-parametric MRI, or an MRI of the prostate, has become a common way for us to evaluate risk as well.
Okay. And when we talk about cancer, typically finding it sooner is better. And I would guess that's probably the same for prostate cancer. What's the benefits of finding it early?
Yeah, prostate cancer, while it is a very common cancer and affects a lot of men, it is a very treatable cancer, particularly if it's identified early. And so early stage prostate cancer can be treated with multiple different options, including surveillance, surgery where we remove the prostate, radiation therapy, or even hormone therapy. So the earlier we find prostate cancer, the earlier we can intervene and the more tools we have available to treat it.
Okay, let's switch gears and talk just about overall prostate health and maybe some prevention that men can do to keep their prostate as healthy as possible. Does diet play a role? Can men eat certain things to promote prostate health?
Yeah, there's been a lot of research into that and trying to find if there's specific diets or supplements that reduce the risk of prostate cancer. And overall, there hasn't been a lot of strong evidence one way or the other. And so the general recommendation is to have a heart-healthy diet where we're watching the amount of fats, carbohydrates, and cholesterol that you eat.
And then what about exercise? Can physical activity promote prostate health?
Absolutely. So physical activity has a great impact on a lot of health in areas of the body, and the prostate is one of those. And doing at least 30 minutes of aerobic exercise 2 to 3 times a week has shown to have a better outcome for individuals who do develop prostate cancer or have other prostate issues.
So diet and exercise are usually the big ones we hit on, but are there other things men can be doing for a healthy prostate?
Yeah, I think the main one is to be in tune with your body and to identify if you're starting to develop some of these symptoms that we've talked about. And if you have those symptoms, the earlier you get evaluated by a physician, the better we can intervene and offer different treatment options to help.
Perfect. So we're just about out of time here. We have about a minute left. Any closing thoughts, tips, advice that you would give to men or our viewers who care about men in their lives when it comes to prostate health?
Yeah, I think, prostate health is a topic that a lot of times we shy away from because it, talking about the urinary system and can be an uncomfortable conversation at times. But as urologists, that's kind of our wheelhouse, and we're used to talking and dealing with those things. And so there's not a lot that you can say that would surprise us. We've kind of seen and heard it all. And ultimately, we have a lot of great things that we can offer to help.
Perfect. Dr. Brown, thank you so much for your time and your expertise this morning. We appreciate it.
No problem.
And thank you so much for tuning in. We hope you'll come back and see us again next weekend. Until then, stay fit, stay well, and stay healthy for life, for healthy living for life. Have a great week, everybody. Thanks again.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health in partnership with AARP Montana. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.